again, welcome to another edition of webinars in the series Illness to Wellness. These are the series of webinars that have been organized by ASSOCHAM since almost past 2 years now, to be exact, in which we have been highlighting various issues related to health, how to be healthy, how to take preventive measures, and they have been very popular and especially very helpful during the periods of lockdown when people desperately needed advice. Not just advice, people needed good information, valid information, brought to them by the specialists, by one of the most important and respected specialists in very diverse fields of medicine from all over the country. So at the outset, I would like to thank ASSOCHAM for organizing these events. And before that, also ASSOCHAM has been organizing preventive healthcare events, camps in communities and organizations, imparting education and health-related activities, free tests, and other things since past 5 years and probably more. So once again, welcome to today's webinar. The the topic today is healthcare during winters. Stay healthy during winters. Winters are a very important season for us. I think we all love, to a certain extent, winters. We love the warm, cozy fire that we burn, the gachak pattis and the halwas and the aloo ka parathas. I think there's so many good things and festivals. All our festivals are in winters, and there's a lot of good memories, I'm sure, good and fond memories everyone has with winters. But winters bring with them some very important health issues. So to discuss them, we have with us some of the most prominent specialists as panelists with us today. I'd like to welcome all of you once again. First of all, I have great pleasure in welcoming Dr. Manju Keshri. She is a consultant in dermatology and cosmetology at Max Super Specialty Hospital in Delhi. I'd like to welcome Professor Dr. Vivek Gupta. He's a senior interventional cardiologist at Apollo Hospital, New Delhi. He is the chairman of Indo-American and European conclaves. I'd also like to welcome Dr. Aparna Jaiswal. She is the director cardiology, Fortis Escorts Heart Institute, New Delhi. And Dr. Arpit Jain, he's the head internal medicine, Artemis Hospitals, Gurgaon. So thank you so much and welcome once again to all of you, our honorable panelists. Thank you so much. I'm welcoming you also on behalf of Mr. Anil Rajput, who is the chairman of the CSR committee of ASSOCHAM. Usually he's always here to welcome our panelists and give an introductory message, but today due to certain assignments, he could not join us. So once again, welcome you on behalf of ASSOCHAM and from me personally. I'd like to kickstart today's session with a question to Dr. Manju. I think there's a very common problem that I have perceived, I have seen in my patients as a diabetologist, that is about the dryness of skin. Everyone is having this problem that Dr. हमारा skin तो बहुत dry रहता है. Is it true? And please unmute yourself. Dr. Manju, please unmute yourself.
Yeah. As we have felt, and it is there also in winters, the weather and air is very dry. So it takes out the moisture from your skin, from everybody's skin. So if the dryness is outside, definitely we lose moisture from their skin. That's why people feel their skin becomes dry in winters. This is the key reason. So one has to apply moisturizers as well as add in diet such things that keeps your skin healthy and moist. Not only we have to, that's why there are lots of things people advise to eat til ka patti and gur. So till has omega-3 fatty acids, and all natural things, the green things available in the winters, one should take, because these things are nutrition, vitamins, minerals, and as omega-3 fatty acids that the skin needs most. As well as we should cover our skin in winters because the weather is dry. So if we cover our skin, we protect our skin from getting dry. So we have to apply moisturizers, cover our skin, and keep the skin moist throughout the day. Not only single application. If the skin is getting dry again, then we have to apply the moisturizers again.
Thank you so much. Thank you so much. Yes. So we have to take care of our skin. I'm sure our ladies would be listening, lady audience, and they would like to be as charming and as gorgeous as two ladies present in our panel today. So they're surely going to follow your advice. Now let's come closer to the heart with our cardiologist friends and panelists, heart specialists. So, Professor Gupta, I'd like to come to you with a question that I've always had in my mind. I've had this impression that somehow winters are the season for cardiologists. Is it true, sir? And they're very busy during this season.
Yeah, during winter season, we are passing through the pandemic. For last 2 years, we have almost washed off, especially the healthcare system. And if you recall, uh, wave one and then wave two, now we are looming at wave three. So the cardiac problems have now increased not only because of winter, but also the COVID has also precipitated the heart problems. So let me talk only about for the moment the winter season, as we have been witnessing for last almost, so when I became cardiologist about 25 years back, 27 years back. So winter surge has been a common phenomena for heart attacks, especially for acute MI. Acute MI means acute myocardial infarction. I think this is a forum where not only physicians but lot of public people are.
Yes, yes, majority for the public people.
So I have to in fact explain more in detail what is heart attack, what is angina, what is coronary artery disease. So coronary artery disease means a blockage inside the coronary artery, which is actually supplying the myocardial vessel. I'm sitting in my office, so I have the privilege of having the heart model here. So it is better to explain also. So not only heart, but also I will like to explain what is heart attack actually. So for the public, I would like to, this is a model where you can see very clearly. And this is the actually left ventricle. And the left ventricle has got supply which is coming from the aorta. This is an aorta. So what the heart is doing, heart is supplying the blood to the whole of the body, including brain. But at the same time, it has to supply blood to its own myocardium, because it is actually self-sustaining system where heart is contracting continuously. But to remain contracting continuously, it has to supply the oxygen to its own muscle. When I'm stopping the hand, I'm resting. My hand is resting. When I'm sleeping, possibly my brain is also partially resting. When you are not moving, your hand muscles and your otherwise leg muscles are resting. But a heart cannot rest. If the heart goes to rest, the patient will die, because a 3 minutes blockage to the brain supply will lead to irreversible brain damage. It can be 6 minutes also. So why heart has to keep contracting? To keep brain alive. Death happens at the site of brain, not the heart. If you can have something extra which is supplying the blood to the brain, which happens during the cardiac surgery when you are putting on the pump, the heart is at least at rest, and you have something else which is supplying the brain. So why heart is important? Because heart has to continuously pump the blood, especially to the vital organ, and most important vital organ is brain. That is why it has to pump itself. Now, to pump itself, it has to supply its own body. Otherwise, how the oxygen will come to the myocardium? And there are three arteries which supply the blood to the myocardium. And these are known as coronary arteries. Coronary arteries are the arteries. For example, I will show you my hand. It's a very good example. And I block this radial artery and ulnar artery like this. And you see my hand has become white. As soon as I release it, it becomes red. I think it's very clear. Again, I do it. I block my radial and ulnar artery, which is supplying the hand. The hand is white. And when I open it, the blood flows immediately, becomes red. And this is what is happening. The coronary artery, here it is radial artery, which is the pulse, and also the ulnar artery, which is another artery which is supplying the hand together with the collateral system. Similarly, the coronary arteries are supplying the blood. These arteries are different from radial artery because they are much thinner. The diameter of the coronary artery is only maximum 3.5 to 4 millimeter. The bore of the artery is only maximum 4, mostly 3 or 2.5, depending upon the starting point and then bifurcating into branches. So there are on the left side, so they are so thin arteries. If the blockage happens to the cholesterol, the supply will be maintained through, for example, a 50% blockage, the supply will be through a 1.5 maximum 2 millimeter or 1.75 millimeter bore. 1.75 millimeter bore is taking your body, is supplying your body, which is so difficult to understand how God has made the system. And unfortunately, for example, the hand is supplied by 2 arteries. Although there are 3 arteries of the heart, but they are supplying the various separate wall. That means one artery is not supplying the other. So that means there is only one artery which is supplying a separate wall. For example, the anterior wall of the heart is supplied by LAD, and the septum is supplied by LAD. So there are 3 arteries: left antidescending artery, then we have a left circumflex and right coronary artery. What happens? If there is a blockage of 50 to 60%, the patient will have no pain, no angina, nothing. He will be absolutely all right. If the blockage happens to about 70% onwards, the patient will have walking pain. He walks for 1 kilometer or half a kilometer, or he goes to the stairs. He will have mild pain. He rests, the pain goes off. This is only exertional angina, and this is a harbinger, and this is a clear-cut symptom of blockage in the coronary artery. Unless you do angiography, we will not come to know where it is. What happens in the winters? What is heart attack? Heart attack is acute myocardial infarction, where on the top of this blockage, which is 50-70%, a clot or thrombus forms. If the thrombus forms, then the artery will be completely occluded, 100%. And if it happens within few hours, that means 1 hour, 2, 3, 4 hours, the patient will have severe pain, because this is something like this. Now it becomes like white. So this will have severe pain, and the patient will have actually heart attack with the ECG manifestation. 50% of the heart attack patient do not reach hospital. This is the worldwide data. 50% of the heart attack patient do not reach hospital. Why? Because either they die at home or on the way, or they have heart failure. So that is why heart attack is so dangerous, and we all fear from heart. And the cardiac death is the #1 cause of the death as of now all over the world. Earlier it was cancer, but now it is a cardiac death. So in the winters, what happens? There is a natural constriction of the artery. So artery which is only 3 millimeter can lead to spasm because of the fall in temperature, especially those people. I'm not talking of the people living like us. I'm talking of the people who are on the road, who do not have a good heating system. In the night, for example, somebody on the road who's sleeping on the pavement, I'm talking such happy. Otherwise, also at home, also if you're not well heated system, so there is a sort of a intrinsic system of some vasoconstriction or spasm or reducing the bore, and which can lead to more chances of thrombus formation and heart attack. It has been seen that the chances of heart attack during winter is 2 times as compared to the summers. #1, this is one study. Secondly, for every drop of 1 degree Celsius drop in the temperature, there is a 0.49% increase in the heart attack chances. So there is no doubt that heart attacks are precipitated during winter, and mostly at the early morning. Why early morning? Because during early morning time, there is a body intrinsic neurohormonal system which leads to increased blood pressure. Diastolic pressure goes up, and the further leading to heart to work hard, fast, more difficult working, and the patient can have a precipitation of heart attack. So I think all the especially elderly, diabetic, hypertensive, or even middle-aged who have a family history of heart disease should be more careful during winters by heating the system, by keeping themselves not going out of the houses for celebration during 31st. Although it is already a curfew, yellow alert in Delhi. So during COVID time, I'll talk a little later, but during the winter time, there is definitely increased chances of acute myocardial infarction leading to death. And sudden deaths are more common. As I told you, 2 times more chances of heart attack. So sudden deaths are more common. And more angioplasties. For example, if somebody is living in Sarita Vihar, I'm in Apollo, and they can really immediately go to the hospital and they can save few lives. but all the patients are not privileged. I always tell all my patients, if you have come to hospital with a heart attack, you are more lucky than those who have not reached hospital. So take yourself, keep positive thought, and you are being saved by our system. And therefore, life is only one. If you can be saved by this system, of course, the primary angioplasty is getting more and more common, but only in the cities like Delhi or some bigger cities. The small cities do not have the system of primary angioplasty. Primary angioplasty means angioplasty during heart attack. But otherwise, we have to do streptokinase and all those things. So we have to be more careful. All the patients who are diabetic, hypertensive, having comorbidity, patients who are having a past history of heart disease, or the patients who have family history of heart disease, or young plus patient, they have to be more careful.
Thank you so much. Thank you, प्रोफेसर विवेक गुप्ता। आपने इतनी अच्छी तरह से, इतनी सरलता से और इतनी सहजता से मॉडल दिखा के हम सबको बताया हार्ट अटैक के बारे में, एंड व्हाट इज द इम्पोर्टेंट रोल ऑफ द हार्ट एंड हाउ द हार्ट अटैक occurs. Thank you so much. Now, because we are in this topic, I would like to come over to you, Dr. Parna. About blood pressure, because somehow blood pressure is linked to the occurrence of heart attack and stroke. So how does our body respond in the way of blood pressure? Is it increased? Would you like to elaborate on this, please?
Thank you so much, Dr. Keshri. I'd like to thank ASSOCHAM and you for having me on board. And I think I'd like to compliment Professor Vivek Gupta for having so elaborately spoken about the heart disease and how it behaves in winter. I think there could have been no more comprehensive evaluation and discussion on the same. And I think my question is in good continuation to where he left as to why is it that we have more incidents of heart diseases, heart attacks during winter months. I think it's imperative we understand that winter, while it brings in along with the happiness and the cheer that we have, the festivals, we have to essentially learn to keep ourselves warm, as just Prof. Gupta elucidated to us. And why is that? Whenever there is cold, chill, there is constriction of our blood vessels. Constriction means there is sukran, they become tighter. And he very nicely showed you the model of the heart. Now, when the pipes become harder, the heart has to pump harder to pump the blood. As a result, whenever people who have high blood pressure, most of us who are seeing clinical practice are seeing our patients coming back to our clinics with higher blood pressures. They themselves come and tell us, Doctor Sahab, पिछले एक महीने से blood pressure बढ़ गया. The reason is winter, along with it, brings along the stukran of our blood vessels. In English or in medical parlance, we say vasoconstriction. Now, this causes hypertension to become increased. Along with that, he also said that heart attacks happen during early morning hours. The reason is there is something called a circadian rhythm. There is a shift of our hormones which takes place in the early morning hours. The release of those hormones are also contributing to changes in the blood pressure. They increase the diastolic blood pressure. Along with it, at that point in time, when the blood pressure is high, our platelets, now these platelets, as he told you about the heart attacks, it is these platelets which form the clot. So while we are having cold winter, we are having the blood vessels which are constricting. He told you that there could be blockages in very small blood vessels. Along with that, the platelets become more aggregating towards each other. Along with it, within the blood system, we know there are certain clotting factors. When we have a cut, we see कि clot बन जाता है and the bleeding stops. Similar structures called fibrinogen also increase during the early winter months, winter hours of the morning time. So all of this together, high blood pressure, yes, it is a reality. Strokes is a reality. Why? These two are because of the problems so well elucidated by Prof. Gupta, and further that platelets become more sticky, there is increase in fibrinogen, all of that together puts us at risk, bringing us to the point that we must stay warm, we must stay indoors, we must stay well hydrated, we must cover ourselves in layers, always remember that, And as Dr. Manju said, we must eat a healthy, balanced diet during winters. We must make sure that smoking is controlled and quit. Alcohol consumption has to be contained. If we work on all of these factors, I think we will be able to brace winters much better and look after our hearts in a better manner.
Thank you, Dr. Panna. That was really wonderful, very comprehensive, and to the point. एक चीज I would just request you to comment on. Do you ask your hypertensive patients or patients with diabetes and such chronic disease or dyslipidemia that they should frequently reassess, visit their doctors, and change medications? Is it so?
Yeah, so I think that's a very valid point. And quickly, all over the world, we have shifted to home blood pressure monitoring. We significantly employ 24-hour ambulatory BP monitoring, home BP monitoring. We urge our patients, and often in our clinics, when patients come, there will barely be a patient जो कहे कि उसके घर पे BP apparatus नहीं है. I always tell them, use that apparatus. Check your blood pressure. We should remove that from our heads कि digital machine अच्छा नहीं है. It gives us a fair idea. If you think it is abnormal, get it counter checked. But you have a very valid point. क्योंकि heart disease increases in winter months, we must make sure that our blood pressure and blood sugar, which are the chief contributors to heart disease, are well taken care of at home. We are there to serve you, but serve yourself first better.
Oh, that's really wonderful, and I think Dr. Aparna has raised a very important and valid point. अक्सर ऐसा होता है कि लोग जब डॉक्टर की क्लिनिक में जाते हैं तो उनका ब्लड प्रेशर नॉर्मल होता है, बट वो जब घर में रेगुलरली ब्लड प्रेशर चेक करते हैं तो वो थोड़ा बढ़ा हुआ आता है। तो ऐसे लोगों को भी ब्लड प्रेशर का इलाज कराने की आवश्यकता है और दवा लेने की आवश्यकता है। थैंक यू सो मच। Thank you so much. I'd like to throw a question to Dr. Arpit. First of all, welcome, sir. Dr. Arpit Jain, he's just joined us. And I would like request Dr. Manju also to contribute to it. Is there anything like allergy to cold or cold allergen? ऐसा कुछ होता है?
Cold allergen. Cold
Yes.
allergen, yes, okay. See, winter is a season when it starts. There are lots of flowers, they bloom. We see even in Delhi and close by NCR, there are lots of flowers, trees, they bloom. Then there are pollens. There are lots of pollens. They give allergy. So during change of weather, the asthma, the allergy because of change is there, and body is going to cope up, and during change of weather, so body has to do lots of things. There are lots of changes inside the body. Pollens are there. Then there is increased tendency to react with these all the changes. So definitely there is during season change, not only during winters, during summers, there is change in, we call it allergy season. So we see lots of patients with the allergy, with the urticaria, even asthma patients, they increase, even the atopic dermatitis, which is also part of it. So these asthmatic, these atopic, and these all allergy patients, they come to us. Urticaria, we call it basically allergy march. So these spectrum of patients we see in the clinic. So definitely it is there.
Thank you. Dr. Arpit sir, would you like to elaborate? Dr. Arpit Jain. So सुनाई दे रहा है sir? Sir, please unmute yourself. Dr. Arpit Jain sir, please unmute yourself.
Hello.
Yes, sir.
Yes.
Good afternoon, sir.
Good afternoon.
So I was asking you about the cold allergy and asthma, which increases. I mean, does cold itself exacerbate asthma? And would you like to elaborate on this?
Definitely, obstructive airway disease, whether it is asthma or chronic bronchitis, COPD, all these things definitely we see increased number of cases during winter. As far as asthma is concerned, it is the direct effect of cold weather, as well as we go into the new season, there are different allergens, sometimes which can also are responsible for increased incidence or exacerbation of asthma during winter months. So cold directly has effect on asthma, and because of different allergens which are more during winter months, it can aggravate asthma. So all patients with asthma or COPD, they should, as already been discussed in relation to cardiac diseases, they should protect themselves from cold weather. They should protect themselves, try to remain indoor. I won't say that they should be remain indoor all the time, but at least during the early morning hours and the late evenings. Yes, they can go out during the warmer time of the day in the late morning or early afternoon. That is very important. And other thing during cold weather, as we see in particularly in our area of NCR and the adjoining areas, during winter months, we see pollution level also increases. There are multiple factors for that, but as we know, cold also is responsible for one of the reasons for increasing pollutants in the atmosphere. So cold, allergies, as well as increased pollution, all these things are responsible for increased exacerbation of asthma as well as chronic bronchitis and COPD.
Thank you, sir. And since we are at it and with you, sir, is any increase in joint pains or myalgia, things like that, pains and aches during the cold?
Generally, cold weather can increase general body pains directly because of cold weather, but in patients with chronic rheumatological problems, they can have more increase in their joint pains and inflammations during winter months. Morning stiffness could be more during winter months. So, and no, not only joint pains, sometimes these immunological disorders, they have what we call as Raynaud's phenomena and problem because of cold. So because of that, because of Raynaud's phenomena, they can have blue fingers and toes, and sometimes that can lead to bigger problems also. So they should protect not only, particularly fingers and toes, they should protect from the extreme temperatures.
Thank you, sir. That's very interesting. That's a very common problem people have, that they have very cold extremities, hands and toes. So, Dr. Aparna, what would you suggest to such people if they have, because it's something quite commonly that we see, especially during the elderly?
So I think as we've been start speaking from the very outset that winter is a time that we need to protect ourselves. We must make sure that we are warm. I even tell my patients not to go out for their morning walks in very wee hours. Some of our patients like to wake up early, and we tell them no, it is not appropriate for various reasons, that they should go out when there is sunlight, simply because their bodies will take it better. It's just what Dr. Arpit mentioned about the Raynaud's phenomena. Everything comes back to looking after yourself better, keeping yourself warm, wearing layers, being susceptible, wearing gloves. I think this is important. Being a diabetic, make sure your feet are well covered. We are well aware that they have neuropathic changes. We've had patients sitting very close to heaters, and because of diabetes, they have not realized that they develop burns, and they come back to us. So these are points which have to be taken home, that during winter, be very vigilant, look after yourself very well, focus on the points which we have been elaborating.
Well, thank you. I think these are some very, very valid observations that you've just made. Now, I'd like to come to something which I think is very close to everyone's heart, and all of us, I'm sure, that is the food, because in winters we actually do enjoy our food. So I'd request each one of you, from your perspective, from the perspective of cardiology and of Manju, and from a general perspective, to give some advice about what to eat, what to avoid, and what is good. So I'll like to start with you, Professor Gupta, sir.
या
क्या हमारे श्रोताओं को, दर्शकों को खाने के लिए बताएंगे?
मुझसे कह रहे हैं?
जी सर, आपसे शुरुआत कर रहे हैं।
तो ठीक है, तो कैसा है खाने की बात, हिंदी में बात कर सकते हैं बीच बीच में,
बिल्कुल, हिंदी
हिंदी
में
इंग्लिश
बेहतर है।
दोनों।
जी।
बिफोर दैट मैं थोड़ा सा एक बात और बताना चाह रहा था. वी आर मिसिंग हार्ट अटैक एंड कोविड एक्चुअली, which I wanted to elaborate upon the time. It's only 1 minute and then we'll come to the food.
श्योर
You see,
श्योर।
the COVID time has shown a different scenario. We were learning in the phase one when we had a 24 March lockdown by Honorable Prime Minister. Following that, unlockdown at 1st June, and then we had Diwali. But that time, the wave had come down, the wave one, which was not that tragic. But at that time, we were learning. We had so many webinars. I did more than 18 webinars in a row with Italy and American people and also French and English. And we were learning because we did not know at that time what was causing death. And it was not only a pneumonia, because there was some deaths which were happening because of when the autopsy was done in Italy at that time, they realized that it was actually a thrombosis, and thrombosis was actually was happening at the lung side and leading to ARDS. It was happening at the lower limb, नीचे पैरों में, जिसको DVT के रूप में, that was causing sudden death in as a pulmonary embolism, and that was also triggering the thrombosis, also being triggered at the site of the coronary arteries, leading to heart attacks. So this virus was dangerous because we learned that something hypercoagulability happens in the body. That's why we were starting doing anticoagulation was started, oral anticoagulations, initially injectable and then oral, and D-dimer was being tested for every patient. D-dimer, which is a system, it was actually measuring the hypercoagulability. So the heart attacks got increased, and at the same time there were no beds. What happened in Europe also and in India, that primary angioplasty was technically difficult because the patient was COVID positive, and the cath lab had to be fully prepared for that. Everybody has to be in PPE kit, and that was actually a testing time for the healthcare worker. And therefore, there was strategy that why not do a thrombolysis with TPA or streptogonic, depending upon the availability of system, rather than going for primary angioplasty, and lot of lives were lost. So not only COVID had the December month, the cold, but also COVID accelerate the process of cardiac or coronary thrombosis. This is what I want to tell you. And that is why if the third wave is coming during winter, because the second wave came during the summertime, and the wave one was also almost during summertime. But this third wave is likely to be during winter. So we have to be more, or rather extra careful, that winter surge, which can lead to heart attacks, and COVID surge can also lead to heart attack because of increased thrombosis. And therefore we have to be careful. And therefore careful means any people, those people who are comorbid, diabetic, hypertensive, I repeat again, smokers, as Dr. Parna said, and as these patients have to be extra careful during winter time, especially this Omicron. We don't know how much bad it is, although it is known to be less virulent for lungs, because the study in Hong Kong has shown that it does goes to the upper part, the trachea, but does not penetrate too much in the lungs. But we are not too sure how it behaves for the D-dimer or the hypercoagulability, because we all are learning, and at the time we have to be careful, because the Delta, and especially the first initial Alpha and Gamma, those two variants were more dangerous for causing thrombosis by increased D-dimer, and therefore these patients were on anticoagulation. So all the people, if they have mild symptoms, they should check the D-dimer and reduce the possibility of having any thrombosis related problems in the heart or anywhere else. Coming on to the khane pine ka, I don't think, rather I see that every diet has to be healthy diet. Not only in winters, in summers also, and healthy diet means taking full stomach, but not that full. Cardiac patients के लिए मैं खास कर कहना चाहूंगा, जब भी हार्ट पेशेंट होते हैं कि अगर आपको 4 रोटी की भूख है तो 3 रोटी खाएं. एक तो ये बात हुई, थोड़ा सा कम खाएंगे तो उसमें ज्यादा, because sometimes there is optimal revascularization, sometimes there is a 1 or 2 arteries left out even in bypass surgery, and there is a possibility of ischemia happening. If you take the full stomach, the chances of having ischemia is more, because the heart has to work harder. Number one. Secondly, healthy diet तो आपको सबको पता ही है कि भाई to avoid junk foods. This is for everybody. Everybody repeats, but everybody does the same mistake. You can't stop your children getting the food from outside. Even I am not able to do it, because वो जो स्वाद आता है बाहर का, जो घर में नहीं बन पाता, I don't know why it is like this. I am not happy. I don't take too much of junk food, but my children, they still take it. I have to really stop them. So junk food means what? You see any food which is cooked fast, and in fact, when you're using the oil which is being recycled, that produces the worst thing. Recycled oils produces more of bad fatty acids and bad fats, which can lead to more cholesterol disturbances. During winter specifically, I don't find any reason. Of course, सब खाना खाते हैं लोग तो गर्म खाना अपने आप ही खाएंगे क्योंकि you need a sort of a soup before this and that. And of course, simple जो खाना है, खाना समय पे खाइए, जितना भूख है थोड़ा सा कम खाइए अगर आप हार्ट पेशेंट हैं, और मोस्टली हेल्दी कुक फूड घर में खाना बना हुआ खाएंगे तो ज्यादा अच्छा रहेगा. अगर हमने कहा चाट पकौड़ी बनानी है तो घर में बनाइए. देसी घी इज नॉट बैड. ऑफ कोर्स दिस रिफाइंड ऑयल्स आर बेटर. ओलिव ऑयल का काफी ज्यादा यूज हो चुका है और काफी स्टडीज भी हैं कि दैट इज द बेस्ट फॉर द कार्डियक पेशेंट. बट एनीथिंग टू अवॉइड ड्यूरिंग विंटर, आई थिंक जो लोग स्पेशली ड्यूरिंग आउटिंग, अभी तो येलो अलर्ट है तो यू आर नॉट गोइंग आउट इन द नाइट, बट मेनी टाइम्स जो तंदूरी और नॉन वेजिटेरियन जो बाहर पे खाते हैं, that has to be completely avoided, and especially during winter time. इसको खाने का जो नॉन वेजिटेरियन, आई एम प्योर वेजिटेरियन, बट those non-vegetarian people, they go and the grills and all those things have to be actually taken care, and these are the things which really help in getting more atherosclerosis, and therefore they have to be prevented.
थैंक यू सर. डॉक्टर मंजू, आपने तिल की पट्टी के बारे में तो बताया, अब और क्या क्या चीज़ें खानी चाहिए और अवॉइड करना चाहिए, और सर्दियों में पानी पीना चाहिए कि नहीं, कुछ बताइए.
सर्दियों में ऐसा नहीं होता कि हमें नहीं, हमारी पानी की रिक्वायरमेंट कम हो जाती है, उतनी रहती है, वो बात अलग है. थोड़ा सा स्वेट नहीं होने की वजह से थोड़ी सी कम हो जाती है, बट ओवरऑल जो बॉडी की वर्किंग है उसके लिए हमें सफिशिएंट वाटर चाहिए. तो वो तो हमें बिल्कुल बराबर पानी पीना चाहिए, नहीं कि ठंडी है तो हम पानी ही नहीं पिएंगे. तो कीप योर सेल्फ हाइड्रेटेड. तो ये सबसे बड़ा पहला मैसेज है. एंड सेकेंडली हम बात कर रहे थे कि
Sorry to interrupt, Dr. Chandra, can I leave because I have to see patients? So program is already going to end now.
Thank you for joining us, sir. Thank you so much.
Thank you so much. Sorry for leaving in between, but there
we understand, sir.
And then I have to do a cat also procedure now. Thank you so much. Thank you for putting me inside.
Thank you. Dr. Manju, please continue.
तो हम बात कर रहे थे कि खाना क्या खाना चाहिए. देखिए,
जी.
is full of green vegetables, fruits, everything is green. तो मेरी एडवाइस है कि उसको हम एज सच खाएं, ग्रीन ही खाएं, रादर देन ईटिंग देम कि बहुत ज्यादा पका के हमने उसके पराठे भी बना लिए, हमने उसे भर के कुछ पका भी लिया. ईट हेल्दी. आप उसे ग्रीन ऐसे ही खाएं बिकॉज दे विल गिव मच ऑफ विटामिन इन नेचुरल फॉर्म. क्योंकि जैसे ही आप बॉईल करते हो, हीट करते हो, पका देते हो, एवरीथिंग इज लॉस्ट. स्पेशली जो विटामिन ही लबाइल है वो सारे फिनिश्ड हो जाते हैं, सारे खत्म हो जाते हैं. वो तो आप ग्रीन वेजिटेबल्स, फ्रूट्स वैसे ही ज्यादा खाएं. तो ग्रीनरी है तो अपने आप को भी ग्रीन रखें. अवॉइड करें बहुत ज्यादा आपने पकोड़े, पराठे और ये सब, बेटर टू अवॉइड. क्योंकि हमारी लाइफस्टाइल अब वो नहीं रही कि वी आर इन बहुत ज्यादा हार्ड वर्क, बहुत ज्यादा काम कर रहे हैं, वी लूज लॉट्स ऑफ कैलोरीज. तो आप बेटर टू अवॉइड एक्स्ट्रा कैलोरीज, पका भुना ना खाएं, एंड सारा कुछ आप ग्रीन फॉर्म में ही लें. दैट वुड बी बेस्ट. और जितनी भी सीजनल फ्रूट्स एंड वेजिटेबल्स, स्टिल ऑल द थिंग्स अवेलेबल इन द विंटर्स, आप सब everything should be added in your diet. Then this is the big message from me कि आप दो everybody knows, सभी को पता है कि हमें क्या खाना चाहिए, but still because lots of things are available, बहुत सारी चीजें हमें, गाजर का हलवा, पराठे, but फिर भी सेहत is most important. So our priority is to be healthy and बीमारियों से बचना है. तो ठीक है, आप टेस्ट जरूर लें, बट वेरी लिटिल, थोड़ा सा अवॉइड करने की कोशिश करें.
Thank you. Dr. Arpit Jain sir, I would like to ask you the same thing. Please tell us about diet, and please also बताइए कि अल्कोहल, बिकॉज लोगों को लगता है कि सर्दियों में तो थोड़ा सा 1-2 पैक लगा लेना चाहिए, उससे गर्मी आती है, ऐसा होता है क्या?
पहले खाने की बात से शुरू करते हैं.
जी.
सर्दियों का मौसम हमेशा रिच डाइट का सीजन माना गया है. फेस्टिवल सीजन भी होता है. दिवाली पर हम सर्दियों का स्वागत करते हैं और तब से शुरू होकर जब हम होली पर सर्दियों को विदा करते हैं, इस बीच में बहुत सारे त्यौहार आते हैं. दिवाली का त्योहारों का सप्ताह, उसके बाद कार्तिक पूर्णिमा, क्रिसमस, न्यू ईयर, लोहड़ी, पोंगल, मकर संक्रांति एंड होली तक तरह तरह के त्यौहार, अलग अलग जोग्राफिकल एरिया में अलग अलग रिलीजन के कई तरह के त्यौहार आते हैं और त्योहारों का बहाना हो जाता है रिच डाइट करने का। और सर्दियों में तो वैसे ही रिच डाइट, गर्मी में थोड़ी सी एवर्शन भी हो जाती है, थोड़ा सा मन उतना नहीं करता रिच डाइट खाने का, सर्दियों में और ज़्यादा, जैसे डॉक्टर मंजू ने बताया, पराठा और ये सब चीज़ें। और इन फेस्टिवल्स में सभी गज्जक, गाजर का हलवा और तरह तरह की मिठाइयाँ। और जैसे डॉक्टर विवेक गुप्ता ने बताया, नॉन वेज वाले बहुत ज़्यादा दे इंडल्ज इनटू मोर ऑफ नॉन वेज फूड्स। तो वो सब हमें अवॉइड पूरी तरह से तो नहीं कर सकते। मैं ये कहूँ आप पूरी तरह से अवॉइड करो और लोगों का पूरा पूरा फेस्टिवल सीजन ही किल करते हैं, वो भी मैं नहीं कहूँगा। वो भी सब, ऑल दीज थिंग्स आर पार्ट ऑफ आवर लाइफ। बट यस, अपनी अगर जिन लोगों को कॉमॉर्बिडिटीज हैं उनको तो डेफिनेटली केयरफुल रहना है, उनको तो पूरी तरह से उनको छोड़ना ही है। अगर वी हैव समबडी हैविंग डायबिटीज, हाइपरटेंशन, cholesterol issues, heart problems, stroke problem, so then and elderly people, they have to be very very careful about their diet. But yes, even young people, they should not indulge too much into that. उन लोगों को भी ध्यान रखना है कि इन चीजों को खाएं, सेवन करें, पर मॉडरेशन में। और एक चीज जो काफी डॉक्टर मंजू ने भी इस पर बात किया था, हाइड्रेशन। हाइड्रेशन को मैं फिर से एम्फेसाइज करना चाहूंगा कि हाइड्रेशन का, और हम लोग उसमें खुद भी हैं, हम लोग भी अपना को मानते हैं कि गर्मियों में हम प्यास लगती है और वी आर वेरी आई मीन कॉन्शियस अबाउट दैट, दैट वी हैव टू ड्रिंक वाटर और समथिंग। बट सर्दियों में अर्ज भी नहीं होता, और बट रिक्वायरमेंट तो बॉडी का उतना ही है। कुछ अनसेंसिबल लॉस जो डॉक्टर मंजू ने बोला, वो हम 500-600 ml का अगर हम उसको निकाल दें, उसके अलावा बॉडी की रिक्वायरमेंट तो उतनी ही है। तो हमें कुछ ना कुछ बहाना करके या कुछ ना कुछ शेड्यूल बनाकर पानी तो पीना है। ठंडा नहीं पिया जा सकता, हम गुनगुना पानी पिए, हम ग्रीन टी की तरह ले सकते हैं, हॉट सूप्स के थ्रोज पे ले सकते हैं, मिल्क ले सकते हैं। वी हैव टू, आई मीन कुछ चीज़ें हमें बनानी पड़ेंगी। कुछ लोग पसंद करते हैं, कुछ हर्बल ड्रिंक्स पसंद करते हैं, वो हर्बल ड्रिंक्स ले सकते हैं अगर हम ठंडा पानी नहीं पीते हैं। वी हैव टू मेक सम शेड्यूल एंड समथिंग which because body need that 2.5 liters of average even during winters also. फिर आपने क्वेश्चन किया अल्कोहल के बारे में। अल्कोहल के बारे में तो डेफिनेटली अल्कोहल जितना हम अवॉइड कर सकते हैं सर्दियों में, अगेन वो भी एक चीज़ है, अल्कोहल का भी सेवन बढ़ जाता है, बहाने मिल जाते हैं। और वैसे भी विंटर्स विंटर्स अपने आप में एक बड़ा बहाना है, और फेस्टिवल बहाने, क्रिसमस, न्यू ईयर ईव और ये सब कुछ, आउटिंग्स, वेकेशंस। सो अल्कोहल का कंजम्पशन डेफिनेटली बहुत ज़्यादा हो जाता है, मॉडरेशन में होना चाहिए। और अगर सोशल ड्रिंकिंग करनी है तो मे बी little bit of red wine can be taken, but otherwise people with definitely with comorbidity should totally try to avoid it, and other people also should control it.
Thank you, sir. Thank
Yes.
you. Dr. Aparna, a few things I would request your opinion on. Obviously, I would request you to tell us about the diet from your perspective, but a few things like some people have this notion that a little bit of alcohol is allowed, and in some guidelines also it is not harmful. And does it so happen that the excess of alcohol may itself precipitate heart attacks? And then please also elaborate upon the role of salt, because probably we take more salt, achars, and all those things during the winters. Then people want to have nuts. It is considered कि सर्दी का समय है जो हमें अखरोट और ये सब खाना है. So ये सब क्या कार्डियोलॉजिस्ट के पर्सपेक्टिव से आप क्या बताना चाहेंगे?
Yeah, so thank you for the opportunity. So at the very outset, I think the diet, I'd like to make a special mention that winter brings along lots of green leafy vegetables. And to all my patients walking into my clinic, I tell them in one way or the other, add spinach in your diet daily. It's the cheapest form of getting a good source of iron. So green leafy vegetables is a prime focus that I lay my emphasis on. Second, I tell that you have to increase your HDL cholesterol, which is a good cholesterol. A very good way to do that is to have nuts. Amongst the nuts, it's walnuts and it is almonds. I tell them to restrict the intake of cashews. They can have some pistachios, but the focus should be on walnuts and almonds. And peanuts are a very good source. It's a poor man's almonds, but peanuts also should be had, but in moderation. So there are two things. And third thing, which you really touched upon, and I was thinking I'm going to come to, is the intake of salt. As in the first half of this talk, we deliberated about hypertension, winter months, blood pressure बढ़ जाता है. We want to bring it under control. While हम दवाई बढ़ाते हैं, most important is contain the quantum of salt. Salt कम करने के लिए it's important to keep yourself on most days away from अचार, पापड़, चटनी, नमकीन. इनको आप कंट्रोल में लीजिएगा, आपका ब्लड प्रेशर ठीक रहेगा. Coming to the last part which you asked was alcohol. Alcohol has been known to increase our good cholesterol. However, it is very clear, अगर कोई पीता नहीं है, उसको पीना शुरू नहीं करना है उसके लिए. कि मैंने सुना था एसोचैम की मीटिंग में कि अल्कोहल तो अच्छी है, अब मैं पीऊंगा. नहीं, अगर आप नहीं पीते हैं, आपको नहीं पीना है. बट अगर आप पीते हैं and you enjoy your drink, which is not a bad thing to do, always in moderation. What does that mean? As Dr. Arpit also emphasized, moderation means for men, it should be 2 small drinks 3 days a week is appropriate. What is 2 small drinks? 30 ml make 1. 60 ml for women, 30 ml 3 days a week. And those who like to consume wine, let us have this sorted here, that wine is surely a better form of an alcoholic beverage compared to whiskey or rum, because it is known to increase your good cholesterol, and it is called the French paradox, because the French drink a lot of wine and they have lesser heart disease. Hence, it is called the French paradox. So I hope I've answered your queries that you posted.
Yes, yes. Thank you so much. I think you very well covered these things which I wanted to. Yes, yes, ma'am, please.
Yeah, this is my personal observation in social gathering. With alcohol, people take lots of unhealthy diet. I think this is the
That's nice.
most
Yes.
important thing we should avoid. If someone is taking alcohol, they can take it in moderate, as Dr. Aparna said. But we have to control the added things what we take along with the alcohol. That is most important, and that is the most important thing that raise alcohol, because we take lots of non-veg and other things, namkeen, peanuts, lots of peanuts. That too fried ones. That one should avoid these things.
I think that is very true and a very nice, a very good observation that a lot of snacks that people have together with alcohol that may be causing more damage to them than just the alcohol. Thank you so much for that observation, ma'am. Now I'd like to come to these home remedies because there are so many home remedies that people talk about that we should be taking during the winters. Dr. Jain sir, what about the kadha? Because there's a lot of kadha drinking during winters, and especially now that the COVID is back, I'm sure many of us would be going back to having their regular kadha every few hours or something. So, does that help? What is your view? What is your opinion?
No, I'm not an Ayurvedic expert, but still I would like, you have raised this question. It's a very valid question and very important question, because a lot of people maybe want to know about this. Many of these herbal things, I don't know how they work, but many of these herbal herbs have antioxidants and anti-inflammatory properties, and we know that. And both these things, antioxidants as well as anti-inflammatory properties, are important for for any kind of illness, whether it is COVID or any other illness, our day-to-day winter issues like cough and cold or flu. So they help to some extent they help. But what is the problem I have seen during COVID days, that people have started taking in excess. As you said, every 2-3 hours they're taking this kadha and all. Then they cause other problems, like we have seen, like a lot of cases of with gastritis and all kind of those problems. So everything is good, but should be in moderation and with good advice of the whosoever is expert in that should take advice from them. Similarly, I've observed about steam inhalation also. During COVID days, people have indulged in a lot of steam inhalation, which destroyed their upper respiratory mucosa, because they were taking. Every 2 hours, people used to take steam, and even those, even as a preventive measure, not only people who are suffering from COVID, as a preventive measure. So I mean, sometimes these things can harm also. But yes, I think Kahda, if taken in moderation, could be helpful in symptomatic treatment and maybe could have some preventive values also.
Thank you, Dr. Jain. I think that is also a very important observation. Dr. Manju, I'd like to ask you one thing that everyone wants to know about the home remedies again about the skin. Like I remember that my mother, even till today, she applies the malai,
Yeah.
fresh cream. So I mean, are these things helpful, and can you give some such advice to our listeners?
See, winter is the season we see our skin gets dry because of two things: loss of moisture and lack of oil. So people use lots of things as a home remedy. What is a home remedy? The things which are available easily at home. These are the home remedies. So to keep our skin hydrated and moist, one can apply the things which are available like malai. It has oil as well as the milk and water. So the cream, what is cream? Cream is moisture, hydration, and oil. So all the things which gives us moisture and oil we can apply at home as malai, as creams, as even the aloe vera people apply because of hydration. It gives lots of hydration. So other things, and even we can apply because in winters the skin becomes wrinkled even because of loss of moisture. So lots of things like banana, gajar, we can take the pulp if it suits you. One should before using any new thing, but anything up to anything before application, one has to check the allergy test. Just apply over the corner of face and wait for a couple of minutes. Then see if you are not getting your skin red or any itching, then it is suiting you. So one can use all the green things available in winters as a pack and as well as a moisturizer, if it is oil or aloe vera or malai. So these are the home remedies one can apply. And the most important thing as a home remedy is eating habits. So one has to take care of your eating habits. Or take all green things, and the most important thing one the people avoid during winters is exercise. So we take lots of things inside, but we don't lose energy. So what happens? It gets accumulated. People become lazy, and uh, they become fat. So exercise and diet, these are the key things one should take care during winters. And all the things which you are taking during winters should be in fresh. So I'll advise not to go for all the frozen things. Take it in raw form, in as a fresh, and all the available. What are the things available in winters? One should consume, and soups, green tea, and till, and even the people can have good, but in lesser quantity because it is rich in iron even. So everything one should enjoy during winters, but in lesser quantity.
Thank you, ma'am. And how good is the application of coconut oil? Because it's quite popular and many people apply it.
See, coconut oil is rich in cocoa, and it is a very good medicine. And but in commercial one, the oil available in packed form from big companies, they lack these things because commercially they are all extracted from the oil. But if it is pure, so it's a medicine. One can apply in all skin condition, in xerosis, in eczema, in itching. It gives good relief because it has good properties. It has healing properties. So coconut is best thing to apply.
Thank you so much. Thank you. Now I would request both of you to give a very short message to our listeners in conclusion. Dr. Arpit, sir. Dr. Arpit Jain, sir.
Thank you. Uh, Winters are definitely time to enjoy and celebrate, as many people want to take vacations and all, and it's a festival season. Yes, nobody wants to spoil your festival season, but everybody has to be careful about their diet, exercise, hydration. These things, because diet, exercise, and hydration, these are the three things generally which are somehow uh, are not properly taken care of during winters. So we should take care of these things. As Dr. Manju said, we should take some time out, maybe during late mornings, to exercise, or we can even do exercise inside our home. We can do yoga, some other small gymming exercise, or if or simply maybe you can do some brisk walking in your rooms also. That's at least something should be done. That's one thing. And other thing which is not covered, I would like to cover is vaccination, adult vaccination. We are talking too much about COVID vaccination, but there are certain other vaccinations which are important, particularly in winter illnesses like respiratory illnesses. So there are two vaccines. Somehow, I would say, unfortunately, adult vaccination has not been talked too much in India. Now, in Europe or in Western countries, there's a protocol about adult vaccination also, but somehow it is a neglected area in India. There are no standard protocols. Many scientific bodies has given their protocols, but it's not a standard thing where everybody has to take this vaccination like we do in universal immunization program, where every children has to be vaccinated. But this is not there. Now we have some guidelines, but we don't have any government program that these people have to take, adult population have to take this vaccination as we are doing in COVID. So two vaccines I would like to emphasize. One is influenza, other is pneumococcal, because most of the winter diseases are, many of the winter diseases are respiratory. So not everybody is required to take influenza vaccines, but particularly senior citizens and people with comorbidities, and particularly with respiratory disease or other comorbidities like diabetes, heart diseases, liver diseases, chronic kidney diseases, they should take a yearly influenza vaccine. And similarly for pneumococcal vaccines, they should take the same class of people should also take pneumococcal vaccine. That can prevent from a lot of catastrophic emergencies. Thank you.
Thank you, sir. And over to you, Dr. Manju, a short message to all our listeners, even though you've said so many useful and wonderful things.
Yeah, the key message for winters is okay, if you have any comorbidity, don't start too early with the exercise, but morning should be started with the exercise and healthy diet. So we already talked about lots of things about the healthy diet, but one should definitely go for exercise. And if not vigorous exercise, it should be mild or moderate according to your physical. Uh, mm, uh, what if you have any illness? Then it should be mild. If you are healthy, it should be moderate to heavy according to your stamina and how much you can work, but it should be there. So, in my message is diet and exercise are the key things which one should always add in your life. If you are doing exercise, then the chances of getting ill are very less. And if not, do some yoga because yoga can be done over a mat only. So I hope everybody has a corner for a mat event. So go for some exercise during winters even. It will keep you warm, healthy, and disease free. This is my key message.
Thank you so much. And Dr. Manju, it is so encouraging for all of us to hear about the importance of diet, green vegetables, and exercise from you, a person who keeps everyone so beautiful. So I'm definitely we are going to pass on this message that not only physicians and diabetes specialists and cardiologists emphasize on the role of exercise and green vegetables, but even the cosmetologists and skin specialists also. Definitely, this is very important. I think so much has been said about the winter months and such important things like diet, like hydration, like the role of exercise. I would just add on to, I won't say I would add on to, just specify that some very simple things that you can include, like keep away from three whites. Try to avoid them. The three whites are sugar, salt, and maida. The lesser you have them, the better. Try to make your food colorful so that you have green, you have red, you have orange, you have yellow. Now you can choose anything. All the vegetables, all the salad leaves, all the fruits. The more colorful your food, the better, except for the spices, obviously. And obviously, moderation is the key here, because the only thing in world which has proven to increase longevity is calorie restriction. That is eating less than you need. So I think if you're all going to adhere to and just consider the advices that have been given to us by all our panelists and specialists, we would fare a lot better in these winters. We'll enjoy these winters and hopefully keep us away from the new COVID and Omicron. So be safe, take all the precautions, always wear a mask, be careful about the sanitization, be close to people, but keep the physical distance. And I think this is the message that we should pass off these winters healthy, and happily. Thank you so much, everyone, to our
Thank
panelists
you.
for being with us and sharing so many nice things with all of us. Thank you so much.
Thank you.
Namaskar and Jai Hind.